Okay. Good evening. So today we are going to learn about the lymphatic system. Lymphatic system is just like our arterial system and venous system. So the lymphatic system is mainly. Can you hear me?
Yes, ma'am.
Yes, ma'am.
Yes.
Good
Okay.
evening, ma'am.
So yeah, good evening. So the
Good evening.
lymphatic
Ma'am, can you
system
give me
is
5 minutes? We have to do one important announcement here.
yeah, sure, yeah, sure.
Okay, thank you so much. स्टूडेंट्स अस्सलाम वालेकुम, मैं डॉक्टर जैनब बात कर रही हूँ। एक इम्पॉर्टेंट अनाउंसमेंट है, वो ये कि जितने भी स्टूडेंट्स हैं जिन्होंने थर्ड पेमेंट और फोर्थ पेमेंट अभी तक नहीं किया है, 30 सितंबर इज़ द लास्ट डेट जो है थर्ड और फोर्थ पेमेंट का, जो $1600 है और $3885 है। 30 सितंबर लास्ट डेट है, और जो इसके बाद कोई भी स्टूडेंट पेमेंट करेगा उनका नाम जो है फिर फोर्थ फ्लाइट के बाद ही आएगा। और जिन स्टूडेंट्स का ऑलरेडी नाम आ चुका है 16 अक्टूबर की फ़्लाइट में और 21 अक्टूबर की फ़्लाइट में, उनके लिए एक अनाउंसमेंट है कि आपका जो वीज़ा है वो आपको डिपार्चर से 10 दिन पहले मिल जाएगा, ठीक है? क्योंकि बहुत सारे ऐसे स्टूडेंट्स हैं उसमें जो हमें बैक टू बैक कॉल्स कर रहे हैं, मैसेजेस कर रहे हैं कि उनको वीज़ा चाहिए कुछ बैंक लोन के लिए, तो आपको डिपार्चर से 10 दिन पहले वो मिल जाएगा। और आपके जो एयर टिकट्स हैं वो आपको डिपार्चर से पहले 5 दिन आपके एयर टिकट्स मिल जाएंगे। बाकी जो भी आपके गाइडलाइंस हैं, इंस्ट्रक्शंस हैं कि आपको 6 AM शार्प जो है रिपोर्ट करना है दिल्ली एयरपोर्ट पे, जो भी आप हमने आपको PDF भेजी है उसको आप फॉलो करें, उसके इंस्ट्रक्शंस आप पढ़ लें और 6 AM शार्प आपको दिल्ली एयरपोर्ट पे पहुंचना है। ओके मैम, थैंक यू।
Thank you. Okay. So the lymphatic system. So in this picture, you can see a lot of things, right? So the lymph nodes, lymphatics, spleen, thymus, thoracic duct, all these are some part of a lymphatic system. So essentially, it is a drainage system accessory to that of your venous system. It consists of an extensive number of extremely variable lymph vessels and lymph nodes through which the lymph circulates. So in the arterial system and in the venous system, the content is the blood, right? So in the lymphatic system, the content is the lymph. So major function of a lymphatic system is to drain excess tissue fluid to the venous system. So at the end of the day, ultimately, the lymphatic system will go and joins with the venous system, and whatever it drains, it will be given into the, or fluid will be given into the venous system. So it drains excess tissue fluid to the venous system. It absorbs fat from the intestine and transports it into the blood. It helps to provide immunological defenses against diseases causing aging. So this is the major importance, and this one also. The immunological defense and also the tissue fluid, the excess tissue fluid will be given to the drains into the venous system. So that is a function of the lymphatic system. So the components of the lymphatic system includes lymph, lymph capillaries, lymph vessels, lymphoid organs. Lymphoid organs include the lymph nodes, spleen, thoracic duct. Sorry, not thoracic duct, thymus, and epithelial lymphoid system and bone marrow. So the components of a lymphatic system includes lymph, lymph capillaries, lymph vessels, lymph organs including the lymph node, spleen, thymus, and epithelial lymphoid system and the bone marrow. So the lymph is a tissue fluid which is seen inside the lymph capillaries. They are clear watery fluid just as similar to that of your plasma of the blood. And what is meant by a chyle? Chyle is also lymph, but it is coming from the small intestine because it is milky white in color and it consists of large amount of fat which is absorbed from the intestine. So the chyle is nothing but it is also a lymph which is coming from the small intestine, which is milky white in color because of the presence of large amount of fat which is absorbed from the intestine. Okay. So the lymph is a tissue fluid that is seen inside the lymph capillaries, which is similar to that of the plasma. So then what is a lymph capillaries? Lymph capillaries are microscopic, blind-ended lymph vessels, which begins in the intercellular space. What is intercellular space? Tissues, you can see a lot of cells. In between, you have spaces, right? So this is known as intercellular space. So from the intercellular space, a microscopic blind-ended lymph vessels will be developed, and that is known as the lymph capillaries. It forms a vast network inside the intercellular space. The lymph capillaries, which are seen inside the small intestine, is known as villi of small intestine, is known as lacteals. Okay, so we can there is a name called lacteals, which are nothing but their lymph capillaries, which are seen inside the villi of small intestine. Okay, and what is chyle? What is chyle?
Granulation.
A lymph from small
Milky
intestine,
substance.
milky white
Lymph
substance
from small intestine.
From where it is coming?
From small intestine.
small intestine.
Small
Intestine.
intestine.
Very good.
Right.
Very good. So you can see that in this picture, this is a venous drain. This is the arterial system, and it is the venous system. So here the artery become the capillaries and then to venules, and the system is continuing. So this is the tissue level. Okay. So here you can see the greenish one. From the intercellular space, some capillaries are arising. They are the lymphatic capillaries. They will becomes like this and goes through these nodes, and then it comes and joins with the junction between two important veins. So at the end of the day, it comes and drain into the junction of two important veins. So here also you can see that all these are tissue cells. These are the cells and these are the spaces. From the spaces, the extra fluid will be entered into the lymph capillaries, and then it is drains and so how it differs from your normal blood capillaries. So this begin blindly in this intercellular spaces. It has larger lumen and less irregular and permeable to bigger molecules. From the intercellular space, protein molecules, all these are very small, larger molecules. All these molecules would they enter into the lymph capillaries. So the lumens are very bigger comparing to that of your blood capillaries. Next, the sites where the lymph capillaries are absent. So these are the sites, that is the epidermis, hair, nails, cornea, articular cartilage, brain and spinal cord, bone marrow, and splenic pulp. So epidermis, hair, nails, cornea, articular cartilage. Articular cartilage are, which cartilage are articular cartilage?
Hyaline cartilage.
Hyaline
Hyaline cartilage.
Then the brain and spinal cords and bone marrow and splenic pulp. In these regions, the lymph capillaries are absent. So what is a lymphatic vessels? So once the lymph capillary is formed, they join together to form a lymph vessel. So they are thin-walled vessels, but they have a beaded appearance. Why it is having a beaded appearance? Because of the presence of numerous valves. Because unidirectional flow is very important in the case of lymphatic system, just like that of your venous system. So for the unidirectional flow, there is needed a large number of valves within the lumen. So that gives it a beaded appearance. So unidirectional flow to the large vein at the root of the neck. In between, it passes a series of lymph vessels to filter and free from the pathogens and harmful agents. So the whatever it is collecting from the intercellular space or from the tissue level, it contains large amount of bacterial agents, microorganisms. So all these things should be cleared off before it comes in contact with the venous system. For that, a large number of lot of lymph nodes are there, and it have to pass through all these lymph nodes and clear all the microorganisms, and at the end it goes and joins with the venous system. Smaller lymph vessels will join together to form the larger lymph vessels, and they are known as the lymphatic duct. So the next level of first we learn about the lymph capillaries. The lymph capillaries will be joined together to form the lymphatic vessels. The lymphatic vessels joins together to form the lymphatic ducts. and that is the larger one. Then it goes and drains into the subclavian vein, which is seen at the root of the neck. All right. So this tissue fluid will be enters into the lymph capillaries. You can see that. So these are the lymphatic vessels. So here you can see the lymph node. Here also there is a lymph node, and these are the valves, which gives a beaded appearance. So from the lower limb goes like this. From the head and neck, the lymph comes and joins it to the venous system. Next, what is meant by a lymphangitis? What is lymphangitis? The condition lymphangitis. Lymphangitis is nothing but itis means inflammation. Inflammation of your lymph vessels or duct is known as lymph vessel mainly. That is known as lymphangitis. What is meant by elephantiasis? Which disease is elephantiasis? Wuchereria bankruptcy is the organism, the parasite which causes the elephantiasis. What is the other name of elephantiasis?
Filariasis.
Filariasis. Filariasis is the name of that disease, and the organisms or the parasite which is the causative for that particular disease is the Wuchereria bankruptcy. Wuchereria bankruptcy. So this is the condition. Here you can see edematous lower limb, increased fluid in between the tissues. So the filaria is caused by the parasite known as Wuchereria bankruptcy. So what will happen? This will be go and clog the lymphatic vessels. So the proper drainage of the lymph through the or the tissue fluid through the lymphatic vessels will be blocked. So the fluid in between this tissue level will increases, and that may causes the edema. So this is the edema is the main sign and symptom of the filariasis. Next, we learn about lymphatic vessels, and the lymphatic vessels join together to form the lymph ducts. There are two numbers of ducts are present. That is the right lymphatic duct and the thoracic duct. So the very important one is the thoracic duct. So thoracic duct is the largest lymphatic duct. Okay, and it is about 45 centimeter long. It starts from the cisterna chyli. Cisterna chyli is a small pea-like structure which is seen in front of L1 and L2 vertebrae. Okay, from the cisterna chyli, this thoracic duct will be starts and it ascends towards the root of the neck. So it starts from the cisterna chyli. So from where the thoracic duct starts, it starts from the cisterna chyli, which is seen in the front of the body of L1 and L2. It ends in the ankle between left internal jugular vein and left subclavian vein. It drains all the part of the body except the right upper quadrant. So right lower limb it is draining, but the right upper quadrant, upper limb and the head and neck right side is not drained by the thoracic duct. It is drained by the right lymphatic duct. Okay, so it is the largest one, 45 centimeter long, starts from the cisterna chyli, joins with the junction between the left internal jugular vein and the left subclavian vein. It drains all the blood, so all the part of the body except the right upper quadrant. So this is the picture. Here you can see this is the diaphragm. So this is the diaphragm. Here you can see a small part. This is known as a cisterna chyli. This is cisterna chyli. You can see the two lymph vessels is come and joins at the cisterna chyli, drains into the cisterna chyli, which is coming from the lower limb. So from here, a duct is emerging and going upwards, and then it comes and joins at the junction between the left internal jugular and the subclavian vein, that is known as the thoracic duct. Okay. So it drains from the lower extremities, left No, left and right, left and right extremity, lower extremities, abdomen, left thoracic region, left upper limb, and the left side of the head and neck. So these are the drainage area, that is lower extremities, abdomen, left thoracic region, left upper limb, left side of the head and neck. Right lymphatic duct is 1 centimeter long. It lies in the root of the neck on the right side. It is 1 centimeter long, which is seen in the root of the neck in the right side, and ends by opening the ankle between the right brachiocephalic vein and the subclavian vein. This joins at the ankle between right brachiocephalic and right subclavian. So where does the thoracic duct open?
Root.
Root of the neck between the junction of internal jugular vein and the subclavian vein. Okay. So the right lymphatic duct is drains from right upper limb, right thoracic region, and the right head and neck. So this is the drainage area of the right lymphatic duct, and this is the drainage area of thoracic duct. Superficial lymph vessels, which is seen in the superficial fascia, and the deep lymph vessels are seen in the deep fascia. The superficial lymph vessels will be drained into the deep lymph vessels. So just for this completion's sake. Next is the lymphoid organs. We have primary and secondary lymphoid organs. The primary lymphoid organs are just for production of the lymphocytes. So the maturation and the initiation of the function, all these happens at the secondary lymphoid organs. So the example for the primary lymphoid organs are bone marrow and thymus. Here the main function is just to produce lymphocytes. Okay. And secondary lymphocytes, lymphoid organs, there is activation of lymphocytes and also for the initiation of the immune response. They are lymph nodes and spleen. Lymph nodes and the spleen. So these are the lymphoid organs. So first is about the lymph node. We already said that the major all lymph vessels will be passed through immense number of lymph nodes for the clearing all the microorganisms before it enters into the venous system. So the lymph nodes are oval or bean-shaped bodies. The total number of lymph nodes in our body is about 450. It's around 500 to 600. And the lymph passes number of lymph nodes before reaching the large lymphatic ducts. So the lymph passes number of lymph nodes before reaching the large number of lymphatic ducts, and they include cervical lymph nodes, axillary lymph nodes, iliac lymph nodes, mediastinal lymph nodes, inguinal lymph nodes, then pre-aortic, para-aortic, pre-auricular. There are a lot of lymph nodes are present, etc. So the lymph will be passes through immense number of lymph nodes. For examples are cervical lymph nodes. Where you get the cervical lymph nodes? The cervical lymph nodes are seen at the neck region. Axillary lymph nodes are seen at the axilla. Iliac lymph nodes, mediastinal lymph nodes. Iliac lymph nodes is all about the iliacal region, that is near the below the umbilicus, and the mediastinal is at the mediastinum. Mediastinum is the area which is seen in between the lungs. So these are the lymph nodes. These are the cervical lymph nodes. So this is the inguinal lymph nodes, axillary lymph nodes, then supraclavicular, the clavicle, the lymph nodes which is seen above the clavicle is known as a supraclavicular lymph nodes. So these are the two different ways to palpate or to palpate the lymph node. So this is one method to palpate the cervical lymph nodes. Cervical, the doctor will be stand behind the patient, and then with the consent, the patient will be palpate the enlarged lymph nodes. And here this is one method to palpate the axillary lymph nodes. Axillary lymph nodes. So what is the structure of a lymph node? Lymph node is a P-shaped structure, oval-shaped structure. So this is just like this. So hilum. Hilum is the area where the afferent lymph vessels will enter. The afferent lymph vessels will leave and the blood vessels enter. So the vessels which is enters to the lymph node through the hilum. Okay. So what is meant by afferent and efferent one? Afferent is the vessels that is coming and joined into the lymph node. So that will be comes and joined through the periphery. Okay. And it goes circulation here inside the lymph nodes, and then it comes out through a single vessel that is known as the efferent vessel. These are the afferent vessel. Afferent, that is enters into the lymph node through the periphery, and the single vessel that is coming out of the lymph node is known as the efferent vessel. All right. Okay. So it consists of a fibrous capsule and a gland substance inside. So it is the lymph node is surrounded by a capsule. Capsule, and the capsule will be forms a small septae inside the lymph node. Capsule will be invest the whole nodes, and there is a space which is seen just beneath the capsule. So this pink color is the capsule. So you can see a small space seen just beneath the capsule. Can you see this? So this space is known as the subcapsular sinus. Space which is seen just beneath the capsule is known as subcapsular sinus. See, these are the afferent lymph vessels. See, and this one is the efferent lymphatics. All right. Okay. So the outer portion of the parenchyma is known as the cortex. So this is the cortex. The outer portion of the gland parenchyma is known as the cortex. And the middle region is known as the medulla. So the middle inner portion is known as the medulla. So the outer portion is the cortex. It is covered by a capsule, and just beneath the capsule, there's a space which is known as subcapsular sinus. And the outer portion of the gland parenchyma is known as the cortex, and inner one is known as the medulla. Okay. Then the superficial cortex is densely packed by the lymphatic follicles. So in here, you can see so many follicles are present. At the cortex, you can see lot of follicles. These follicles are follicles just like this, nodules, which consist of large amount of lymphocytes. So the lymphocytes will be arranged just like a small nodules, which are seen at the cortex. All right.
Yes.
So, okay. The nodules are of two types. Two types of nodules are there: primary nodule and the secondary nodule. I said that at the cortex, you can see large number of nodules. The nodules are the packaging of lymphocytes. Okay, lymphocytes are packed in such a way that in a small nodules. If the germinal center, if that is germinal center, I'll tell about the germinal center. See, this is a germinal center. When you take a nodule, there will be a darker region outside and a pale region inside. Okay. Darker region outside. Either the periphery is densely packed with the lymphocyte. At the center, when you look, they're very faint or less stained. So this is known as the germinal center. Got it? The nodules shows less dense central region is known as germinal center. If the germinal center is present, then you called it a secondary nodule. If the germinal center is absent, then you call it as primary nodules. You got it?
Yes, ma'am.
Yes, ma'am.
Okay. Okay. I'll tell one more. That is, the entire lymph node is covered by a capsule. Just beneath the capsule, that is the covering. You get a subcapsular space. Then we are coming into the gland parenchyma, At the periphery altogether, you call it as a cortex. Inside, you call it as medulla. So inside the cortex itself, the lymphocytes are arranged in nodules. So when you take a nodule, you can see that if there is germinal center present, germinal center means there will be a less dense central region than that of the peripheral region. Okay. If the germinal center is present, then you call it as a secondary nodule. If it is absent, you call it as a primary nodule. So how the germinal centers form if the nodule that particular nodule undergoes any immunological reaction or is subjected to any immunological agent or a reaction, then the germinal center will be formed and thus it becomes a secondary nodule. Okay. So at this stage, you just remember that if the germinal center present, you call it a secondary nodule. If it is absent, you call it as a primary nodule. And this nodule is present in all lymph organs, even if it is in the spleen, in the thymus, in anywhere, the germinal center and the nodules are present. Okay. So the inner portion of the cortex is called the paracortex. That's not that important. So in this picture also, you can see that this is the capsule. This is the capsule, and this one is the cortex, and here this is a nodule. See, this is darkly stained, and this is less stained. So this one is the germinal center. Okay. Next is the medulla. When you come to the medulla, you can see that here the lymph nodes, lymphatic lymph cells, lymphocytes are arranged just like a cords. Not nodules, they'll arranged just like cords. So they are known as medullary cords. Okay, in this picture you can see that. Okay. So here just focus on this region. This is the medulla. You can see small sinuses. See, this is one sinuses. This is another. This is another. So all these are the lymphocytes arranged in a small cords. And here you can see the follicles or the lymph nodes. See, this is the germinal center. So in this nodule, there is no germinal center. Here also there is no germinal center. Here also there is no germinal center. You understood the thing?
Yes, ma'am.
Yes,
Okay.
ma'am.
Yes.
Okay, this is the picture. So this is the medullary cords. This one is the medullary cord. This is the capsule. This is outer cortex, inner cortex, and the medulla. And these are the secondary nodule because there are germinal centers are present. Next is how the circulation takes place. I already said that in a case of a lymph node, this is the hilum. The afferent lymph vessels will be comes into the and drains into the lymph node. Then it passes through the cortex, then to the medulla, medullary sinuses. Then it drains out through the efferent vessel. So this is the circulation. Afferent lymph vessels brings the lymph to the lymph nodes, flow through the subcapsular cortex and medullary sinuses, leaves the gland through the efferent lymph vessels. So these sinuses are lined by the phagocytic macrophages. So lymph nodes are the only structures that filter the lymph. That's the reason why the lymphatic vessels will go and drains into every lymph node. And the spread of the cancer is more common. The most common pathway for the spread of the cancer is the lymphatic vessels. So lymphadenitis is the inflammation of the lymph node and it is very painful. Next is about the spleen. Spleen is another largest lymph organ. It is another largest lymph organ. Lymphoid organ, which is located in the left hypochondrium. What is the hypochondrium? So you can divide your stomach, your abdomen into quadrants. Okay. So this is the right side and this is the left side, and here you will get the ribs. These are the ribs. So the area which is seen just beneath to the this rib is known as the hypochondrium. So the spleen is seen as at the left hypochondrium, which is covered by the capsule. And the capsule, just like the lymph node, it enters and forms small septae or a trabeculae. And the major part of the spleen is it consists of red pulp and a white pulp. Red pulp and a white pulp. So the white pulp is the lymphatic tissue that surrounds a central artery. So when you focus the white pulp under the microscope, you can see a small artery at the center or at the periphery. Eccentrically, there will be an artery which is surrounded by a lot of lymphatic tissues. So the lymphocytes, just like a nodule. Okay, that is known as a white pulp. So the lymphatic tissue sheath that surrounds the central artery. Periarterial lymphatic tissue sheath, otherwise PALS, possesses a nodules with or without the centers. Germinal center is known as a splenic nodules. It's nothing but there will be a central artery which is seen eccentrically that is surrounded by a lot of lymphocytes which is look like a nodule. That is known as a splenic nodule. Sometimes there will be a germinal center present and it is sometimes it is absent. So it just look like a splenic nodule. That is known as the white pulp. And the red pulp is just like your medullary sinuses. So here there are so many, here the lymphocytes will be arranged just like a cords, anastomosing cords. So they are known as the red pulp because in between the space of the cords, the blood sinusoids are present. So altogether, when you look at the red pulp, it gives a reddish in color, or pinkish, more pinkish color. So the red pulp is a network of anastomosing splenic cord or cords of Billroth. The cords are made up of B and T lymphocytes, macrophages, plasma cells. You see in the space between the cords, it is filled with the sinusoids. Sinusoids are just like your blood capillaries. In this picture, you can see this is a lymph node. Please mute your mic. See, this is a splenic nodule. This is a splenic nodule, right? All right, here you can see eccentrically placed central artery. And here you can see a lots of lymphocytes. At the center, there is a germinal center. Okay, that is the white pulp. And the red pulp is here. Here there are so many cords are present. In between, the blood vessels are present. That is a splenic cords, the red pulp. So this is another microscopic picture of a spleen. So this is the splenic nodule. Here, this is the central artery, and this is a nodule with the germinal center. And here you will get the red pulp. This is the red pulp. Okay. What are the functions? It filters the blood from antigens and microorganisms. It evokes the immunological response against the antigens circulating in the blood. It produces B and T lymphocytes. It removes old and abnormal RBCs. That's why the spleen is known as, what is the other name of, or the better name of a spleen?
Graveyard of RBC.
Graveyard of
Very good.
RBC.
It is the graveyard of RBC. And it forms blood cells during the fetal life. It helps in phagocytosis. Phagocytosis means engulfing the unwanted things, and it helps in stores the blood also. Okay. What is a splenomegaly? Splenomegaly is a condition where there is increased size of the spleen so that it is palpable per abdomen. Normally, spleen is not palpable per abdomen, but if there is any increase in the size of a spleen, in the case of any cancer conditions or due to any infections, the spleen is palpable. That is known as a condition. Sign is known as a splenomegaly. Next is about the thymus. Thymus is also another lymphatic organ. It is a lymphoepithelial bilobed organ. Lymphoepithelial bilobed organ, which is located at the superior mediastinum. Mediastinum is the area which is seen in between your two lungs. Okay, So heart is seen in the middle mediastinum. So the area which is seen between the two lung. This region is known as the mediastinum. It is of three compartments. That is the anterior, then middle and superior mediastinum, middle mediastinum, and inferior one, like that. It is classified just like that. At the middle mediastinum, you will get the heart. All right. So this thymus is seen at the superior mediastinum. And it is devoid of lymph capillaries and lymphoid nodules, central lymphoid organ, which is essential for the development of other lymphoid organs. We already said that the thymus is a primary lymphoid organ where there is production of lymphocytes takes place. So it degenerates when the age advances. So this is the lungs. We separated the lung. This area is known as the mediastinum. This green one is the bile of the lymph nodes. Okay, bile of the lymph nodes. The bile of the thymus. Okay, and the thymus is surrounded by the capsule. It forms small sweat inside. But here you can't see any nodules. Okay, here the lymphocytes are just randomly placed. It has a cortex and a medulla. So the cells of the thymus, it includes the epitheliocytes or the epithelio-reticular cells, next the lymphocytes and the macrophages. So this is the characteristic cell which is seen inside the thymus. Okay, epitheliocyte. So the site of production and maturity of the T lymphocyte is the thymus. So T for T orthogonally, that is, the thymus is the area where there is maturation of the T lymphocyte. The T lymphocytes are responsible for the cell-mediated immunity, and the B lymphocytes are responsible for the blood humoral immunity. Okay. So the Husser's corpuscle is a new terminology for you. That is an important feature of a thymus, which is seen at the medulla. Okay. They are concentrically arranged, flattened cell with the center with a homogeneous hyaline material. So Husser's corpuscles are nothing but the degenerated epitheliocytes are arranged concentrically, just like a rose petal. And at the center, you will get a homogeneous hyaline material. So this is known as Husser's corpuscle, which is a characteristic identifying feature of a thymus under microscope. So the Husser's corpuscle is the important feature of the medulla of the thymus. Here, the degenerated epitheliocytes are arranged concentrically. At the center, you will get a homogeneous hyaline material. So this is the Husser's corpuscle. So this is the hyaline material, and these are the degenerated cells. See? In this picture here, this is the cortex. This is the medulla. At the medulla, you can see this is Husser's corpuscle. This is another. This is another. So this is the characteristic feature of a thymus and identifying feature of thymus under microscope. Next is another group of system, that is epithelio-lymphoid system. Epithelio-lymphoid system is a large amount of unencapsulated lymphatic tissues which are seen in the walls of alimentary canal, urinary tract, and the respiratory system. See, unencapsulated. That is that the organs that we discussed all the organs have the capsule, but in this epithelio-lymphoid system, they doesn't have a capsule. There are unencapsulated lymphatic tissues in the walls of the alimentary canal, respiratory, and the urinary tracts in order to for the local immune response. So it's the submucosa, the alimentary, respiratory, and the urinary tract can be the layers of the these tracts is the inner one is the mucosa, submucosa, muscularis externa, and the serosa. So these are the layers of histological layers of alimentary, respiratory, and the urinary tracts. So the mucosa is the innermost layer. Just beneath the mucosa is the submucosa. Beneath that muscularis externa, and the outermost is the serosa. So at the submucosal level, you will get the epithelial lymphoid system or the lymphatic tissues. Got it?
Yes.
Yes.
And they are termed as MALT. MALT means mucosa associated lymphoid tissue. This things is seen in between the mucosa and the submucosa or pure the submucosa. That's the reason why it is known as mucosa associated lymphoid tissues. They are unencapsulated. There are two other types of epithelial lymphoid system, GALT and the BOLT. This is gut associated lymphoid tissues and this is bronchi associated lymphoid tissue. BALT is seen in the respiratory tract and the GALT is seen in the alimentary system. Next, the important collections or the aggregation of the MALT. So the examples for the mucosa associated lymphoid tissues are pharyngeal tonsils, tubal tonsils, palatine tonsil, lingual, Peyer's patches, and the abdominal tonsils. See, these tonsils are also organs which consist of large amount of lymphatic lymphocytes. Their main function is for the protection or the immunological reaction. So the pharyngeal tonsil is otherwise known as adenoid, and the tubal tonsil is which is seen at the level of nasopharynx. We have a palatine tonsil in the tonsilla fossa. Lingual tonsils are the tonsil which are seen behind the posterior aspect of the tongue. Peyer's patches are the microscopic structure which are seen in the small intestine. Abdominal tonsil is nothing but the appendix. Okay. When you take the microscopic structure of appendix and all, you can see a large number of lymphatic nodules at the mucosa of the appendix. So this is a histopathological or the microscopic appearance of the tonsil. This is tonsil. You can see a large number of lots of lymphatic nodules are there, and this is the crypt of the tonsil, and this is the gross appearance of the tonsil. This is your uvula, and this is the tonsil, enlarged tonsil. Okay, maybe because of some tonsillitis, this tonsil is highly enlarged. Next is about the bone marrow. Bone marrow are soft, pulpy, vascular tissue which is seen inside the bone. Okay, it consists of a delicate network of reticular tissue stroma that clusters of hemopoietic cells. Hemopoietic cells are the stem cells which are can produce the cells, blood cells. Okay, like RBC, WBCs, and all. So the bone marrow has only one role for the production of the lymphocytes. Okay. Okay, only this much. So in this, from this slide, you should know about what is a lymphatic system, what is the different grades of the circulations, that is lymphatic vessels, starting from the capillaries to vessels and the ducts. Then you should know about the thoracic duct, starting from where and ending where. Next is about the lymph node, the structure of a lymph node, structure of spleen, and also the structure of a thymus. Okay. All right. Okay, thank you.
Thank you, ma'am.
Thank you so much.
Thank you, ma'am.
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 Excuse me, ma'am. Ma'am.
Kindly wait. Maybe there is a network issue at ma'am side. So please wait.
Yeah, sure.
Uh, Students, kindly leave the meeting as of now and rejoin again. We are going to host it again.